everyone, to the Greeley Healthcare Podcast. We're going to be talking about some of the things that are pertinent in today's COVID-19 environment that we're receiving multiple inquiries from our client base. Today, we're going to be talking about preservation of personal protective equipment, or PPE. My name is Lisa Eddy. I'm the advisory consultant for the Greeley Company. I'm a registered nurse and have a background in nursing leadership and compliance and a number of assorted avenues. I do want to talk today a little bit with Philip Bose, who is our Greeley consultant in the compliance arena. He comes to us previously from the state agency, one of the state agencies, where he did a review for CMS, the conditions of participation for many healthcare entities. And also, Philip has a background and is certified from APIC as an infection control specialist. So I thought it would be great to get Philip's perspective on how it is that a regulator would review an organization's implementation of an interim measure for preservation of PPE, which would include extension and reuse. And I wanted to make sure that we talk to you a little bit about providing a risk assessment when we do this. We can't just say, poof, this is what we're going to do. You need to have a very strong risk assessment and considerations of all the issues that are challenging and facing an organization when we will move from best practice of not reusing PPE to extending or reusing PPE. And so that's what this broadcast is about. It's not about all of the things that you're going to do to achieve a preservation of PPE, but it's about what you need to consider to develop guidelines for your staff and how to best do that. And so with that, I'll take a minute and just ask Philip a few questions that have been on my mind and coming in from several of our hospitals. So with that, Philip, can you tell me what are the major considerations that you would be looking for to make sure that an organization was compliant with the infection control condition and also with your accrediting agency's standards for infection control when an organization crafts a guideline to preserve or extend PPE?
Well, I think the first major consideration, and I'll count it as one, is patient and staff safety. Those are the two big things. Then the next thing you would want to look at when you're trying to decide what to do is look at your current supply or availability of PPE. You know, you don't really want to jump the gun and start to reuse PPE when it's not necessary. And at the same time, an organization wouldn't really want to wait until supplies run nearly out. The next thing an organization needs to do is look at what the literature is saying, and the major player here is the Centers for Disease Control, the CDC. But there are also organizations like APIC that most people know, SHEA, which a lot of people don't know. They're the Society for Healthcare Epidemiology of America. People like the WHO and the World Health Organization and the FDA, you want to look at these things too, and in other journal articles. So you want to see what those thought leaders are telling us to do. So the CDC, APIC, SHEA, and WHO, they're all kind of helping us out with how to do infection prevention correctly during a time like this. The FDA just came out in March, and they're now allowing for enforcement discretion for certain modifications to FDA cleared devices. They're allowing wireless and Bluetooth capabilities for remote monitoring. They're adding alternative production sites to allow non-medical device manufacturers to produce ventilator parts. They're allowing hospitals and other healthcare providers to use masks that are actually intended for other environments or beyond their shelf life. They're encouraging emergency use authorization to increase production of ventilators, things like that. People kind of forget the FDA as we go. So just to recap, or the major considerations that we would want to look at are patient and staff safety, review of your current supply of personal protective equipment, and then a thorough literature review to determine what the thought leaders are recommending.
Thank you for that, Philip. That's great. I appreciate that that listing. That's helpful. I have had an organization ask me, what is the difference between extended use PPE and reuse of PPE? And I know many of us in infection control understand that, but look, can you just give me a brief overview of that?
Yeah, there again, the CDC has defined these terms, and basically, when the bottom line, it comes down to it. Extended use is using the same PPE for a repeated contact with several patients without removing the PPE. So that's extended use, is you do not remove the PPE between patients. Reuse is using the same PPE for repeated contact with several patients. However, each time you would remove and replace the PPE with each encounter. So that's examples would be face masks that you could place on and take back off, or eye protection that you would put on and take back off, or don and doff. Extended use is preferred over reuse because there's a lot less chance of cross or self-contamination with extended use, because when you remove PPE and replace PPE back, there's a higher chance that you can contaminate yourself.
So when an organization's running through their list of considerations and whatnot, they should probably define when it's okay or permissible to move from extended use to reuse.
Right, correct.
Okay, okay, and so that should be in their list. Okay, I appreciate that. And then I would like to know, I'm sure there are, I haven't gone through the CDC guidelines in detail, but when should an organization not move to extending or reusing PPE?
Yeah, there are recommendations, again, in the CDC guidelines, that you do not want to reuse or have extended use for patients that are under investigation for COVID-19. You do not really want to use PPE that's not intact, or or PPE that's visibly soiled. That's sort of a rule, whether you're in the middle of a crisis like this or not. You always, if you're going to use an N95 mask, if you're going to reuse it, you always want to check the seal before each use. So if you don't have a good fit, you don't want to use it. So if the fit's not adequate, you can't use that N95 mask. A really good idea that's discussed in the literature is to cover the mask with a face shield, and this protects the mask from becoming soiled, and you can use it longer.
Great, thank you for that, Philip. I'm just, as a note, I'll tell you that one of our infection control consultants was observing use of N95 respirators throughout the day and found that staff did not check the seal periodically as they're supposed to. So thank you for bringing up the business about the seal, because I think that's important. Then I would like to know, where would you direct organizations to get best practice information?
Well, again, as we have discussed earlier, I think the number one source is the Centers for Disease Control. But also you can go to the FDA, to APIC again, to SHEA, the World Health Organization. I think, as you mentioned earlier, Greeley has a COVID-19 resource page, which you can link to from its main website at greeley.com.
Okay, and then most importantly, because that's what we're really wanting to talk about today, which is, how does an organization come to agreement on preservation of PPE, extension of PPE, and reuse? How do they get that methodology sort of together and foster it out throughout the organization? I'd appreciate your thoughts on that, especially from your regulatory background, because we know that when all of this is over, regulators are going to come in and they're going to review how the organization approached some of these things. So, Philip, what do you think about that?
Well, I think they should use their risk assessment process, which they use for lots of things in the facility. So they should conduct a thorough risk assessment, which includes a literature review, as we discussed earlier, from all those thought leaders, and also a regulatory review. What are the regulations saying about trying to begin reuse or extended use? You want to, when you do that risk assessment, you should ensure that all the necessary players are at the table. So leadership, infection control, risk management, nursing, respiratory therapy, all those folks, physician leaders. Major determination, again, is to be made is when to begin reuse and extended use. And that's going to be based upon your risk assessment. So you want to ensure that the appropriate leadership bodies approve the organization's position. And once they have, you want to draft guidelines or an interim policy. You want to create some educational materials and educate staff. Infection control practitioners, again, as you said before, should go and they should observe to ensure that the education was effective. Are people using the mask correctly? Are they donning and doffing correctly? Are they checking for the appropriate seal? Are people using soiled PPE? They want to look and observe that these things are being done correctly. And then as events progress and improve, the leadership will need to decide when they need to remove the interim measures and go back to business as usual. So I think just their normal risk assessment process would work in this situation.
Okay, I appreciate that. As Philip, as you and I have talked over the prior weeks, one of the things that I really want to stress that Philip mentioned was we need to have uh, leadership needs to approve a go forward and an end date for this interim measure of extending or reusing your PPE. What we don't want to have is, I mean, there's been so much information on the internet. I'm sure all of you out there have heard people, yes, it's okay to use a banana peel or an orange peel as a PPE in an emergency. That we want to kind of make sure that we have a very well crafted, organized set of guidelines that hospital staff can follow. And when those guidelines go into effect, because you will have staff that will reuse PPE without really thinking about it, and then they're going to come and say to you, "Oh well, we're in we're in a crisis, and so we decided we had to do that." That no, we want to make sure that the organization has a crafted set of guidelines that's been vetted throughout the organization, and that they've been given the go-ahead to implement those interim measures, those guidelines as they are written. And then, as Philip pointed out again, at what time do we announce to the organization staff, okay, now we have to go back to being best practice, as safe as we possibly can be, which would be not to extend or reuse PPE when we're not in a crisis. So those are sort of some of the things we wanted to talk about. And as stated, we will have a sample risk assessment, just a template, the core things that for any risk assessment that you're doing in an organization that we suggest that you follow that sort of cover the regulatory requirements of a risk assessment. And then we'll have a set of recommendations or recommendations really for consideration when you craft your PPE extended use guidelines or PPE preservation guidelines. So that is what we'll have for you. Philip, is there anything you'd like to add?
Yes, one more thought that I just had is that with this advent of homemade PPE, part of this risk assessment would be determining when you're going to allow this homemade masks and gowns that people are donating, when you're going to allow those to be used in the facility. I think that would be another important point.
Perfect. I appreciate that, Philip, and I appreciate you taking the time today. So, folks, that's what we have for today. We will have posted for you the risk assessment template, as I discussed, and a set of considerations that we think you should look at that address unintended consequences and downstream impact, pros and cons sort of situation. And then we'll also have some information on this on our blog, our COVID-19 blog, and you can reach all that information when you go to greeley.com. That's GREELEY.com. So thank you very much for your participation, and we look forward to talking to you again soon.